Well, in this week's Cardiology Countdown, we begin at the number 3 slot with a paper in JACC on TAVR. This is an application of the new standardized definitions of outcomes for TAVR, the transcatheter aortic valve replacement, and looked at a meta-analysis of 16 different studies. And they found overall that the device success was 92% across all these studies. All-cause mortality didn't need a definition, but that was 7.8%. They had major vascular complications in just under 12%. Interestingly, permanent pacemaker implantation was 13.9% across all of these studies, and major stroke was 3.2%. And so this becomes a very nice benchmark for any future studies where one can apply the same definition and then also look at the body of evidence to date. At the number 2 spot is an interesting single-center study looking at appropriateness criteria for echoes. We all order lots of echoes, and in this study they looked at 1,800 echoes and applied the new 2011 appropriateness criteria, of which there are no fewer than 98 indications deemed appropriate. And they found overall that 82% of the echoes were deemed appropriate by these criteria, and 12% were inappropriate, and some couldn't be classified or uncertain. And the most common inappropriate one was patients who had routine surveillance of LV function if they had heart failure and hadn't had a clinical change in status. And so again, I think a positive finding that most of the echoes have good clinical justification, but this may also be the wave of the future that we have to pick appropriate criteria when ordering tests. And at the number 1 slot is a randomized trial published in Lancet of a mobile stroke unit, and this is in Lancet Neurology, where they have an equipped mobile unit that has a CT scanner, a mini laboratory, and telemedicine connection. And so they sought to see, could they shorten the door to needle time for thrombolytic in stroke patients. And indeed, they stopped the trial at the interim analysis after just 100 patients, where they had reduced in half the time from 76 minutes down to 35 minutes from the first emergency call to actually receiving fibrinolytic therapy, and that as compared with a streamlined hospital-based care system. And so here we see the acute MI therapeutics making it to acute stroke management with speeding up and potentially enhancing and broadening the number of patients who can be treated with thrombolytic therapy. So for this week's Cardiology Countdown, I'm Chris Cannon.